If I don't know the answer myself, I will certainly get them back to you. Whether Danielle can certainly facilitate that and give me the question, and I will find that answer for you. Does that work for you, Danielle?
Yes, that sounds good.
Okay, perfect. Okay, so client engagement and self-management. The first piece really is what is it? So just a quick overview of the presentation. So what are the important concepts related to client engagement and self-management? What are the critical components of good chronic illness care? And then what are some strategies for engaging patients, developing wellness toolkits, and working through relapse, which I really think is probably the key piece of things. So working to kind of work through those barriers, look at them before, that way you can plan for those barriers, and that client then has a much better chance of working through those. So definitions of engagement. I particularly like this, sorry, my little thing's here in the way and I can't quite get it to go away. Janelle, sorry everybody, do you know how to make that little box go away? Can you see that at all on the side?
Hold on. Let me just move my thing. I don't see a box that you're talking about, but if you're talking about your own dashboard, there should be a red arrow pointing in, and that will hide the control panel.
Got it, perfect, thank you. Sorry everybody, I'm pretty new to webinar stuff. So, okay, so engagement, employing strategies to motivate clients to access and use services and tools to manage their illness. And really the important piece is to utilize the client to help manage their own illness and have them do some of that work so that they learn how to manage their illness in a way that makes sense for them. So self-management is a process that clients can use to look at their health behaviors and then make choices to improve their health based on their knowledge, skills, and attitudes. Okay, so for those of you who haven't seen the chronic care model of care, it's really an important piece that kind of brings everything together. So in that above blue bubble is kind of everything that's involved to create what we want, which are improved outcomes. So there's the community, there's the resources and policies that are in place, there's the health system overall, what's available, the funding, all those fiscal pieces, the healthcare organization itself. There's the delivery design system, so how do you deliver care, whether it be through advanced access or booking appointments, or how you deliver the time you spend with your clients, the decision support that you give to your clients, the actual clinical information system, so do you work through paper, do you work through an electronic medical record, and the self-management support, which is a really big key piece and one that's really in the forefront of healthcare right now. And together those really help to create improved outcomes through an informed, activated patient, and together along with a prepared, proactive practice team. So as a practice team and as clinicians, we work really hard to be prepared and be proactive in our care. We inform our clients and we activate them so that we have productive interactions. So this piece is a really important thing to take into account, to remember that there's a whole bunch of different systems that come together to create these outcomes. So some of the barriers to the client engagement can be system barriers. Those might be culture, infrastructure, and finances. So what's the culture of your organization or of the system that's delivering care? What's the infrastructure look like, whether that be staffing, whether that be the number of physicians to the number of nurse practitioners to the number of nursing staff and allied healthcare professionals you have within your team? What's your budget and what are the finances? You know, what resources do you have as a facility and what can you offer? Some of the patient barriers might be activation. So are they activated? Do they want to take part? Literacy, a really key point to remember if you're handing out any tools or if you're handing out any form of literature to your clients, what's their literacy level? And making things easy to understand will be really key moving forward. The diversity, so your clients are all different, and you need to remember that when you sit down and you're using these tools and you're talking to your clients and setting goals. Unpredictability, so what's happening within that client's lives, what's happening surrounding them, remembering that life is unpredictable, and again, finances. And a key thing that I thought I always remember from the Choices and Changes workshop is that often as clinicians and providers, what we do is we overestimate the resources that are available to a client. So always, checking in with the client to see what's happening. Do they have food security? Do they have proper housing? All those other pieces that are really important as the backbone and infrastructure for that client to be able to make positive health behavior change. So self-management and chronic disease, there are those 5 A's, that assessing, advising, agreeing on goals, assisting, and arranging. And this little chart is really great. It's really easy to follow. So you really have to assess that client's beliefs, their behavior, and their knowledge. So what are their beliefs around diabetes? What are their behaviors around diabetes? And what's their knowledge? If you're talking to somebody about diabetes, if you're talking to somebody about any other chronic illness, and it could be hypertension, it could be anything along those lines, what are their beliefs, their behaviors, and their knowledge about that? And then you want to advise them. So provide specific information about health risks and benefits of change, remembering that you want to make sure you're thinking, if you've done that Choices and Changes webinar, where are they in the stages of change? So advising them with the appropriate information. And then you want to agree. And the key thing with this is to collaboratively set a goal. You don't want to make the goal for this patient or this client, because in order for them to actually succeed, that goal has to mean something to them. So it's really something that you have to come to an agreement on together. And then you want to assist them. So help them to identify personal barriers, whether it's child care, transportation, financial, anything that's going to perhaps get in the way of them succeeding and being successful in meeting this goal. What are some strategies to overcome those barriers? Help them to problem solve, and what are some problem solving techniques? And then what's happening within their social and environmental support. So do they have somebody at home to help them? Do they have resources within the community to help them meet this goal? And then arrange. So specify your plan for follow-up. Really important to have follow-up. And again, I always really try to state that it doesn't have to be face-to-face follow-up. It can be a phone call. It can be a mailed reminder, taking into account literacy level. But letting them know that you're there and that there's somebody else there that's going to help them to follow up if they need somebody there. In the very center of all this, it talks about a personal action plan. We're going to go through some examples later on, so I'll just move through past this if that's okay. So some system strategies for addressing barriers to client engagement. So in the actual culture piece of the system strategy or the system barriers, there's that change in healthcare form to engage clients in self-management. So we're really moving away from that provider telling our patients and our clients what they need to be doing, how they need to do it, to this culture of self-management. So informing clients of what's in their best interest and what's the best practice and what do they really need to be doing to be healthy, and then having them manage that and make their own decisions. There's also professional standards to involve clients in healthcare decisions. So there's lots of best practice out there now about setting goals collaboratively and having clients work at a level that's appropriate for them. And there's also the patient's expectations for care. And that's a really important piece, because some clients might not necessarily understand that they have the right to make a decision within their health care. And I think we as providers can do them a great favor in letting them know that we want them to be part of their health care and we want them to be part of that decision making. In income structure, it's really that personal health information. So how are we storing it? How do we have access to it? Making our own lives easier as clinicians, but also do clients have access to their personal health information as well. Performance information, so are you meeting goals? Are the clients meeting the goals? How are we tracking those goals? And then client safety, obviously, those client safety improvements. So what can we do to make sure that clients are safe when they come into the center and that they feel safe as well? There's also the financial piece of things. So there's the Ontario Diabetes Strategy, which offers a lot of training for providers on self-management training. And there's also, of course, the self-management program in Southeastern Ontario, which offers multiple self-management programs for clients and providers. So really taking advantage of some of these programs that are existing right now and working through those. So engagement intervention, so there's really two phases of the treatment. It's that initial attendance. The clients have to attend first. And then you have to get them there first in order to kind of get going with the self-management. And then, of course, there's the ongoing retention. So the clients have to continue to attend. So it's important for success that this can be implemented in all areas of chronic disease prevention and management. So engagement interventions and the CDPM model, which is the chronic disease prevention management model. So redesigning the system to assure effective and efficient clinical care and promote self-management. So not only are we providing really good, high-quality clinical care to our clients, but we're including them into that planning as well, and we're promoting self-management. So we need to create a culture and organization and mechanisms that promote effective interaction, workflow improvement, and self-management. So the way that we do some of these pieces is through clinical information systems, updating client CPP, looking at the electronic health record to track assessment scores like your confidence and your conviction. As such, we talk about that in choices and changes. Appointment attendance, so are they no-showing all the time, and perhaps what are the barriers for them not showing, and how can we plan to overcome those barriers? And the patient action plan as well, so using that on a regular basis. There's also decision support, so promoting self-management strategies consistent with scientific evidence and client preferences, making sure that as providers we're that prepared, proactive team, that we know what those best practice guidelines are, and that we know how to advise our clients about some of the positive behavior changes they can make. And telephone engagement and use of the client action plan. You don't have to meet face-to-face every time, and that's really important. I understand that everyone is very busy, and perhaps you don't have all the time to meet face-to-face, but it might take a 5-minute phone call. So self-management, again, using evidence-based guidelines to help clients address barriers to achieving self-management goals. And then community services is another really big piece. As an actual organization, you might not have the means to offer a lot of programs, but knowing what programs exist within the community can really help you link with community services, again, for childcare, transportation, activities. And all this helps to reduce no-shows, helps patients achieve their goals, and it's a huge issue. So remembering to use those community services that exist because they can mean all the difference for a client that's struggling to meet a goal. So how do we create informed and activated clients? So the really big piece of this is that they don't require an expert. They should be easy. They should be easy as a provider to fill out, and they should be easy for the actual client to fill out as well. It's important to rely on natural support, like friends and family and neighbors, instead of the actual just canned programs. Those programs are really useful, but you also have to really rely on those supports at home. And how much that client has at home, because they're more likely to use those more than a program. Again, saying that, programs can be important as well, and you should offer them to clients when you're aware of them and when they're running. They also should be applied across a range of conditions and not just a single disorder. And really, health behavior change is about changing your health behavior in order to be healthier in an overall level. So although you might focus a few goals in one particular condition, they really should be applicable across all those conditions and help to change health behavior so that their overall health status changes and becomes more positive. Again, meet people where they are through the course of their illness and recovery. So remembering that the goals might be smaller or larger depending on where they're at in their current health. And the other piece is that any self-management tool should fit on a refrigerator door. It shouldn't be so large and so encompassing and so difficult that somebody can't look at it very quickly, and it should be small enough that they can store it somewhere. So what to avoid? Remembering to avoid gender bias when you're creating these tools or using these tools, considering different populations like the LGBTQ population. Does the client self-identify male or female? All of these are important pieces when you're looking at action plans and goals and making sure that they're not gender biased in any way. Making sure that there's no cultural bias. If you have a very large multicultural center, it's really important to make sure that that tool isn't biased in any way that way. Literacy assumptions, again, making sure that it's easy to read and at a very simple literacy level. And if a client cannot read, taking the time to sit down and walk it through with them. Excessive focus on medication management. Again, medication management is important, but it's not the only piece of self-management. And there's lots of other pieces and behaviors that go along with medication management. And avoiding that word compliance. It really is quite, I want to say, it's a word that is condescending in some way, and it puts the provider above the client, which is something you really want to avoid when you're working together. So this is one toolkit that I thought was really interesting, and I thought I would pass it along. It's the Wellness Action Recovery Plan in WRAP, and the website's just there below, www.mentalhealthrecovery.com. And this really focuses on mental health recovery, but can be applied across a total span of chronic disease prevention management. So these are kind of the key pieces, and again, look it up online. It looks pretty interesting. So the Wellness Toolbox is used to develop the WRAP plan, which is the Wellness Action Recovery Plan. So it's a list of activities that clients have done in the past or could do in the future to help them stay well. And we cover a lot of this in Choices and Changes in talking about how using a previous goal that they've met in success and translating that into a new success to meet a different goal. And then another list of activities that clients can do to help them feel better when they are not doing well. So again, planning for relapse. And these are, these are set in a different way, but really they're the same idea. The elements of a written WRAP plan are a daily maintenance list. So what are the things that they need to do on a daily basis? What are the triggers that perhaps could come in the way? So what are those barriers? What are the early warning signs for that client that something could be potentially troubling? When things are breaking down, what do I need to do when I start to spiral, let's say, out of control, or things are just getting too difficult? And then that last piece of crisis planning. So again, planning to overcome those barriers, and what are the strategies? So examples of some self-management tools. The Wellness Toolbox example, so talking to a friend, talking to a healthcare professional, and these are some of those strategies. So what do I need to do when I start feeling like perhaps things are getting a little out of hand for me and my goal is slipping away? Peer counseling or exchange listening, focusing exercise, and I know there's lots of the mindfulness and movement pieces that are coming out now, and really looking at the overall person on every level, spiritually, mentally, physically, and putting those all together. Relaxation and stress reduction exercises, guided imagery, journaling, so writing in a notebook. And the key with this is to avoid, if you are doing some pain management with somebody and some self-management that way, is to avoid pain logs in chronic pain self-management. What happens is that it puts so much focus on the pain that they're in that you kind of get away from some of those other positive pieces, and it really puts a negative spin. Creating affirming activities for that person, exercise, diet considerations. So really encompassing that whole entire person when you're looking at barriers and when you're talking about what we need to overcome and what can get in the way. So what's some of the elements of that WRAP plan? So the daily maintenance list might involve how you feel when you're feeling well. List the things you need to do for yourself every day to stay well. And I really like that piece. A lot of the time, people put themselves last and family or friends ahead of them, but pointing out what they need to do for themselves every day to stay well is a really important consideration. List reminders that you might need to do based on how you're feeling. So if somebody's feeling extremely tired and fatigued one day, what do they need to do when they're feeling that way to either rest or make themselves feel better? Triggers. List those things that, if they happen, might cause an increase in your symptoms, or things that may have triggered your symptoms in the past. And again, using those past successes or those past barriers to then move forward is really important because they're very real for that client. They've dealt with them before, and looking at how they dealt with them can really be important to help them move and be more successful in the future. And then writing an action plan that you can use if triggers come up. So again, planning for those barriers or potential barriers. So when things are breaking down, list the early warning signs that you've noticed in the past when your condition worsens, whatever that condition may be, and write an action plan to use the early warning signs come up. So perhaps that client needs an action plan for triggers and an action plan for when they feel like things are breaking down. And then finally, crisis planning. So develop a crisis plan slowly when you're feeling well. And it's really important to develop that plan while you're feeling well so that you're not creating a crisis plan when you're already feeling in crisis. Use that crisis plan to instruct others about how to help when you're not feeling well. And that crisis plan keeps you in control even when it seems like things are out of control. It ensures your needs are met because others will know what to do. So involving family and friends and peer support network that you have so that if you are in a really difficult place, that everyone knows what to do and how to help you. And it also saves time and frustration. So I'm just going to go through some action plan forms with everybody. And I put a few in here. So again, with action plans, you don't have to use a particular form. It's really important to use a form that works for you as a provider, because I know each provider works differently, and find an action plan that works for your client as well. So again, looking at literacy and all those different pieces, they're all essentially the same type of tool, but you need to find one that works well for you and your client. So this one goes through, in writing your action plan, be sure that it includes, 1, what you're going to do, 2, how much you are going to do, 3, when you are going to do it, and 4, how many days a week you're going to do it. And what you'll notice about the action plan is that it is very action-based. So it's very specific and it's very detailed. Again, remembering that these goals should be very small in the beginning. So if a client comes to you and they want to start exercising, an unrealistic goal might be to exercise an hour every day, 7 days a week. And talking through that with somebody and looking at the different barriers, they probably will recognize that. So maybe backing it off to something that they can succeed at the first week or the first 2 weeks, and then slowly increase that goal to get them where they want to actually be. So an example of what are you going to do this week? This week I will walk 2 times. I will walk 2 times around the block before lunch. So very, very specific. So again, we follow the example. This week I will walk around the block. That's the what. That's that first piece. 3 times, or before lunch. That's the when are you. How much are you going to do it? When are you going to do it would be that 3 times, and how many days a week. So, and then on the, what's nice about this is that you can then chart that confidence and that conviction rate that we talk about in choices and changes, so that the next time they bring this action plan in, you can see what they're at, and you can kind of look at that trend of their confidence and their conviction rate. And this also allows them to check off, did they do it Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, so that they can really keep an ongoing record of whether they're meeting these goals, and that as well the provider can keep an ongoing record as well. This is another self-care action plan. Pretty simple. My goal is to walk before lunch 3 times a week for 20 minutes each time. That might be their goal. I will make the following small changes as I work toward my goal. And the things that can make it difficult to reach my goal are, so this action plan actually puts down the barriers for them. And my plan for overcoming these difficulties include, and it might be I will have my husband, my spouse, my partner, my mom, my support person, whoever's in their life, I will have them watch my children while I do this. So, and the support and resources I will need to achieve my goal include, and they can list those as well. This one also looks at the confidence and conviction, that confidence being how confident am I that I can achieve it, and that conviction being how important is it that I reach this goal. So this is probably one of my more favorite self-care action plans because it really goes through the entire list of things on one sheet of paper that you can use with your clients and then have them return with it. This is another example. This one's a little less busy. It has a little more pictorial for those that like that. They choose one goal, I will, and then they have their examples just on the bottom: increase my physical activity, take my medications, make healthier food choices, whatever they're choosing. And then choose another action, I will walk more, eat more. This one's much more simple and not as in-depth, and it might work well for a particular client that you feel doesn't do well with all those details. Again, this one just looks at confidence, not so much conviction, but you certainly can add it in at the bottom. This is one on depression, so a depression self-care action plan. It's a little bit more in-depth, but does work quite well for somebody that perhaps is struggling with depression and you're trying to do some self-management with them. This one really doesn't travel well across all and is meant just for depression. So it talks about staying active, doing something fun that you think, or doing something that you think is fun each day, spending time with people who help or support you. During the week, I will make contact for at least, let's say, 2 minutes with and their name and what they're going to talk about. That way, you're looking at social inclusion and all those pieces with depression. Talks about relaxing, and then it talks about setting simple goals. So I quite like this one when working with somebody who their self-management is really around depression. So I have a great video to show everybody. This is a BC-based video, but it talks a lot about the movement out there towards working with clients and patients in a self-management aspect. It kind of covers a range of different healthcare pieces, really. I guess I will play that video now, and then perhaps we can do questions after.
More and more BC doctors are seeing the value of supporting their patients in self-management.
Self-management and is central around the doctor-patient relationship. I think the doctor-patient relationship is built on trust, it's built on respect for your patients.
I am a very independent person. I do not want people doing things for me, but I will accept things at times.
We have to change our way of thinking and understand that, hey, people are the experts in their own care, and we're just guides along the way.
I like to look after myself. I like to prove that I'm capable, and I am capable.
When your patient comes in and you come in, you have your agenda as a doctor. Your agenda might be keep your office on time. You know, let's find out what the problem is, solve it, and move on to the next patient, and try and do that in a quick, efficient way. And the patient's agenda might be, you know, I'm really worried about something, and I really want my doctor to discuss that with me so I can understand and be less worried about it. So instead of kind of running with my agenda, I have to bite my tongue sometimes and just say, don't say anything. The story has to be told, and you must listen. So a little voice in my head says that.
Supporting patient self-management makes good sense. After all, it's the patients that have to make lifestyle changes and monitor their health. For doctors, it means fewer and less protracted visits. Physicians use various methods to promote self-management. One way is through an interviewing technique that incorporates 3 key questions. Dr. Allison Rankin demonstrates.
Hi. How have you been? Horrible, horrible couple of weeks. Tell me what happened. I've been in lots and lots and lots of pain. So what is it that you're worried about? What worries you most? Too much. Too much pills, too much smoke. It's just, and it's not doing anything. I'm still in pain. Okay. So worried a lot about all the chemicals you're putting into your body, hey? Yeah. What do you think you'd most like to change? I'd like to change the pain without taking anything more. Have you ever considered that smoking might be contributing to the pain? No. It has been shown that smoking can make pain worse. Are you thinking about cutting back on smoking? I'd like to. And how confident are you that you'll be able to cut back on the smoking? right about now where I am pretty confident because it's getting, I'm just smoking more and more. And you know what? When I'm having a cigarette, I'm craving a cigarette. And then I have a pill because the cigarette gives me a headache. And
So how do you think you might go about making that change?
with a lot of help.
Yeah. So you're thinking you might cut back on smoking, you might try to quit.
First of all, cut back. I couldn't just quit.
So could you tell me exactly what your plan is?
Well, my plan would be to have a cigarette and then try and go a whole hour without one. And for me, that would be doing good.
Okay. Starting tomorrow then,
Yeah.
you're going to have an hour, a full hour between cigarettes.
Yeah.
And we'll
Yeah.
follow up with you in a week.
Okay.
Does that sound okay?
Yeah.
Okay, great. I find that using those 3 questions is a lead-in to help patients to develop an action plan which allows them to make some very small, measurable change so that at the end of the week or the end of the month they can say, I did it, and they can go on to the next one to work towards their long-term goal.
I'm always surprised that I actually learn something a little bit extra when I use the 3 questions. It rarely takes more than 1.5 minutes to get the patient's agenda if you just listen properly.
Both Dr. Egan and Dr. Rankin also run group medical visits as a means to do clinical follow-ups with their patients and to promote self-management.
Before I came to the pain group, I had no one I could actually talk to about how I felt and know that they would actually understand where I was coming from.
Did you have an action plan?
What are you working towards? I forget.
Creating action plans is central to patient self-management, even in group visits.
I'm doing well. I was only smoking about 18 cigarettes a day.
Yeah.
And since I saw you last Tuesday, I've smoked 4 cigarettes.
That is awesome.
I like the action plans because they make me accountable. I think the action plan for me allows me to actually complete something.
Doctors often have their medical office assistants follow up with the patients to see how they're doing with their action plan. They monitor the patient's health periodically and keep in contact by phone.
When I got involved in the self-management, I had to kind of stop and really think about it myself as to what it meant for me. And I came up with a document and a statement, which was really my message to my patients. It involved, caring for them in a respectful, dignified manner, and it also involved, for me anyway, some idea of preventative health and taking care of themselves in a timely manner.
I had nasal on last night.
It is.
Yeah, I noticed it this morning when I took my blood sugar.
A brighter future for primary health care in British Columbia is dependent in part on doctors supporting their patients to manage their chronic conditions and on patients in turn stepping up to the challenge.
Okay, so hopefully that video was a little helpful and you got some different views on how some other people are utilizing self-management within their own practice and making it work. Again, it doesn't have to be just with them face-to-face. Again, they say they're medical office assistants. Here that might be their RPN or their RN. It could be a health promoter, a social worker, whoever that client's really involved with. So just some ideas on where to learn more, where to get some access to some more documents. There is a really good website at the New Health Partnerships. It is designed to facilitate collaborative self-management, engaging patients, family members, and healthcare providers who want to work together. There is the Institute for Healthcare Improvement, which is where Choices and Changes comes from, and they have lots of really great, teachings and courses available. There's the MacArthur Foundation on Depression, which looks at where I got that one depression self-management tool. There's another Hope to Healing, which is really quite good as well. And then there's obviously the self-management of Southeastern Ontario, and if they have lots of documents available on the web for everyone to use. So just wondering if perhaps there's any questions, or if anyone just has any comments even about perhaps if they're using action tools or action plans and some tips that they have, or maybe some different resources that they have that they would like to share.
Well, at the moment, we had 2 questions come in during the presentation, so if anybody else has any, feel free to ask one by either the question tool or the chat tool. But earlier on, Dawn was wondering if CHCs or FHTs in the region have funding and staff that work specifically on self-management support for individuals outside of the group session, like example, outside of the Stanford courses. So I'm also going to unmute Dawn in case she wants to converse back and forth about her question.
Sure, that'd be great.
Thanks, Dan.
So within the community health center, at least as far as I know, and within the family health teams, they do have usually, they do hire the diabetes educator. Often their nurses are really focusing and training on the smoking cessation, which really is a self-management program. I know that our chronic disease prevention management nurse looks after all the chronic diseases and sees those clients on a regular follow-up. So she does our smoking cessation, our diabetes management. She'll talk to clients about, I guess, hypertension, any real chronic disease, and she works with them on self-management, so how they can self-manage those conditions. She'll provide them with tools and whatever they need, and then meet with them on a regular basis to ensure that follow-up. Most of us work in a self-management, I want to say, on a proactive level that way. Our dietitians work that way. Our health promoters work that way. We have a community resource worker that does that work for us as well if clients need help being linked up in the community. So our funding really is based around that, I think, that self-management piece, and that's a big part of our practice, if that's helpful, Dawn.
So essentially it's integrated then into all of the variety of areas and specialty clinics. So
it is, yeah.
Not as a specific job description for one person that does self-management education.
Essentially, yeah. Again, I would probably put the most common person to be doing, if they were going to put that in someone's job title, would be the chronic disease prevention management nurse here. But it really is integrated into everything we do, and I do believe it's almost in at least our community health center. It's part of our vision and goals is that whole self-management piece. We do offer, again, lots of different programs, and you do not have to be a client or a rostered client of the health center to access those programs. Often, you can just phone in and get put on a wait list.
We're doing similar things here in Prince Edward County.
Oh, okay. Do you work at
the Prince Edward Family Health Team?
Oh, Prince Edward Family Health Team. Okay. Yeah. So I know. I guess it would be. I know Mary Woodman. And through there, and yeah, I know that they do some really interesting things out that way. But yeah, unfortunately, we don't have one person that would run self-management. It just seems to be interwoven into all our policies within the center.
Yes, and I think that's very similar. A lot of our specialty clinics are doing those sorts of things, but I'm just finding that not only do I do some self-management organization within the family health team for the Stanford courses and that sort of thing, but I'm also the primary care nurse and coordinator for a family physician. And so it's just kind of tricky to be integrating the way we want to do that self-management work within primary care and using those tools consistently. So I was just wondering how other places were doing it, that's all. And I guess I have another tiny question, sorry to take up the time, but in regards to how you document that in an EMR.
Yeah, so we actually just moved, we used to use Perkinji. I'm not sure if anyone else is aware of that one, but so often we would do an action plan with the client, and then we would have to have them bring it back or scan it in to their record. Right now we're moving into a new EMR called NOD, so our own processes are a little kind of up in the air right now, but we're hoping to actually be able to create that action plan or have it built in somehow. Again, those are pipeline dreams, I think, at this point, but we really just use those tools. and scan them into the client record when they bring them back. And then that client can then have an ongoing record of them as well. But it does take time and it is tricky. And I do understand as an NP and a family health team, you are booked very quickly throughout the day.
Thank you.
You're welcome.
And Dawn, did that conversation sort of answer your other question, or did you want to bring that up again, the whole quality care coordinator piece?
I've forgotten my other question. Oh, yes, that did answer it. Thank you.
Okay.
Now, if anybody else has any questions, feel free to put something in the chat log or in the question tool, and we'll give that just like a minute or so. And then otherwise, I guess we'll end this. If anybody else has tools that they would like to share, that's welcome as well.
Yeah, or any comments, I guess, in the sense of does anybody use any action plans right now, and how have they kind of incorporated them into their practice with the limited time they have with clients?
Well, I'm not seeing anything come up, so unless something shows up in the next little moment, I didn't know if you wanted to say any last words, but otherwise something I'd like to mention is that the recording of this webinar, as well as any future ones, in case you're not able to attend one of them, will be available on our website on an archive page. So again, I'll provide that link in the follow-up email that you should get sometime tomorrow as well. So hopefully everybody will be able to use that too.
So I guess just some parting words quickly. I just want to thank everyone for coming. If you have any comments or anything post the webinar, feel free, obviously, to pass them on to whatever link was available on your, I'm assuming, Danielle. And then at the same time, really use your allied health team that's there within your organization. They can then be part of that follow-up, and if you as a provider don't have time to do some of these action plans, if you have a nurse or an RPN or somebody you work with and they have some time, maybe perhaps using them somehow. So again, it doesn't have to be just you doing all the work yourself. Certainly use your team around you, and all that does is really create a bigger support network for your clients.
All right, so I guess we'll say thank you as well on behalf of the Southeastern Ontario Self-Management Program. And please visit our new website for more information on the upcoming webinars as well. So if you go under the healthcare professional section, there's one on professional development, and you'll be able to see the list of tentative webinars scheduled for the rest of the fiscal year. And we'll also send out reminder emails with the registration links as the dates become closer. So thanks again, and hopefully we'll see you at the next webinar as well.
Thank you, everybody.